If you suffer from severe facial pain known as trigeminal neuralgia and you've been considering surgery, stop scrolling. This video is just for you. The three most common surgeries that people will consider for trigeminal neuralgia: number one is going to be microvascular decompression, or MVD. Number two is going to be looking at gamma knife, or number three is going to be nerve ablation. And the reason why I'm making this video today is because we recently had a patient who came to us who's already had an MVD surgery and 2 gamma knife surgeries. She was considering going for the ablation, had some concerns, and that's why she wanted to see us first. But I'll explain more about her case and how that relates to these surgeries later in the video. So here we can see where they're making the incision for an MVD, or microvascular decompression surgery. Essentially, this is where a small incision, we can see just up here, is happening behind the ear. Part of the skull is going to be cut away, and then it's going to try and essentially remove the pressure that may be on one of the cranial nerves because of a blood vessel, essentially kind of like untangling the area and making a bit more space. The logic here is that if there is compression coming from the blood vessel, that may be what's pressing onto the nerve and causing this extreme facial pain that the patient is suffering from. Next, we have the gamma knife surgery, and this is a little bit different. This is a bit less invasive. There's no cutting of the skin. Instead, this is using a high dose of radiation in the area. It's going to be focusing it on that area of the brainstem where that trigeminal nerve is starting to come out. And what it's essentially trying to do is just stop it from sending as many messages. You can think of it a bit like, say, having a garden hose on the floor and it's using radiation to prevent as much water flowing through it, so there can't be this painful sensation that's passing to the face. It may look a little bit scary, but it's probably not as scary really as it is. This is also a treatment that's not just for facial pain. It's also used for other growths such as tumors. And thirdly, we have radiofrequency ablation. As you can see here, this means there's going to be an insertion into the skin. So it is a bit more invasive, but it is quite similar to the gamma knife. But instead of using a frequency of radiation, here it's going to be directly using heat to essentially kind of burn the nerves in the area. For some people, this may show to be more effective than something like gamma knife. However, it is more likely that there can potentially be some other risks because it is a bit more of a strong dose that's being put into the area. As there is an incision, this also makes it more likely to potentially have risks going on or be associated with this kind of surgery. This could be things like an infection in the area, or maybe even a leak of the CSF, or the cerebrospinal fluid. Like most surgeries, these procedures would not be the first choice from their doctor. This is usually going to be started with things like medication or other alternatives before going to something as extreme as surgery. But unfortunately, due to the extreme nature and the pain that's caused by trigeminal neuralgia, it's been nicknamed the suicide disease. It has become more common that people are then looking for other approaches, as it's very common they may take medication even for many years and it may not be as effective. It's also common that people may start by taking painkillers, such as something low level, like say taking Panadol, and they may need to take more and more and more as it becomes less effective. Then they take something stronger and something stronger and something stronger. And that, mixed in with the 2 procedures we first talked about, is exactly what happened for my patient. I've been in practice and seeing cases of trigeminal neuralgia for more than 10 years, and this has been a very common thread that we've seen with patients. It starts with medication, they increase the intensity of the medication, and some may then resort to surgery, and that's where they may eventually come and see us. And unfortunately, that was the same for this patient. She's somebody who has had this kind of pain, this severe stabbing, aching, gnawing, hot pain into her face since the 1980s. She's had a number of different types of medication, including morphine and fentanyl. And then she's already had the surgery, the MVD, and then had 2 follow-up gamma knife surgeries, which offered some level of relief at the time, but then the problem came back. And this is nothing against the doctors or the surgeons who've done it. I'm sure they've done an amazing job, and I'm sure it was very clean, very good work. But unfortunately for her case, it may just be that it's not getting to the root cause of what is actually causing the problems, and what's really leading to that irritation that continues on her trigeminal nerve. Here in the practice, we specialize in what's happening in the top part of the neck and how the nerves running through can be interfered with or affected, which may lead to some problems such as trigeminal neuralgia. In these top 2 joints, just above them is where we have the brainstem, and if there is irritation to these joints, it can start to mechanically pull through that area. That can affect how those cranial nerves are functioning, such as the trigeminal nerve, and if there continues to be irritation in this area, it may still persist with these symptoms even after certain types of surgeries. And it can be even one of the reasons why some of those blood vessels in the area may seem like they're pushing more on that area of where we see the trigeminal nerve, because if there is still this mechanical dysfunction there. It's going to not just pull on the nerves and pull on the joints, it'll pull the arteries. It's going to pull all the other surrounding structures and affect them all in different ways. And I've seen for many patients in the past where they've had these kinds of operations or surgeries, and unfortunately, it just wasn't as effective. And it doesn't mean it isn't for everybody. I'm sure there's lots of people who it's very effective. It's such a horrible condition, and they're then able to live their lives normally afterwards and then get back to what they want to do most. But for some people, unfortunately, it's not effective, and that's where maybe a different approach is needed. If you suffer from trigeminal neuralgia, and maybe you've tried different types of medication in increasing strengths over the months or over the years, maybe you tried a number of different types of approaches, such as you've tried physiotherapy, maybe you've been for acupuncture, you've had stretches, you've tried different types of supplements, maybe you've gone for surgery or you're considering going for a surgery at the moment, then perhaps there may be something going on in the top part of the neck, which may be a contributing factor. We have over 10 years of experience working with patients with trigeminal neuralgia, and we work alongside your medical doctors, such as neurologists, so we get the best for your case. If you suffer from trigeminal neuralgia and you want to know more, comment TN down below or send us a message to find out how we can arrange a complimentary call to discuss your case and see if we can help. We'll do our best to refer you to somebody who can.